Did you know that hernias are not a modern problem? Hernias have long been diagnosed even in Egyptian mummies, and the great Hippocrates also wrote about it. At that time, the treatment were outlandish and varied from, hanging people upside down or pushing the hernia swelling with the foot. But fortunately, the modern science has evolved, and now we have got so many high-tech surgeries for the treatment of hernias, which can be done in 30 minutes, and a person can resume his or her activities within a day. Hi, I am Dr. Anshooman Koushal, and I am a laparoscopic and robotic minimal access surgeon based in Gurgaon. Friends, today we are going to talk about a very common yet problematic issue, which is hernia. Now, what is hernia? Hernia is nothing but it's a weakness in the abdominal wall through which the internal contents like intestine or fatty tissue tries to come out. I can give you an example. You can just imagine that there is a fence with a hole and a car is trying to push through that hole and is try to come out. Now this is hernia. Normally it is not noticeable, but over a period of time it grows from small to big, and then it might give rise to various symptoms ranging from subtle discomfort, abdominal pain, dragging discomfort, to sudden severe sharp pain and swelling, which initially was reducible. That means when you were lying down, the swelling could go back in its position, and when you strain harder or when you are upright, the swelling protrudes. Now, what causes hernia? There are so many causes of hernia, including the genetic causes, when because of the weakness of the tissue itself, a person can develop hernia at any point of his life, or it can be because of certain acquired conditions like lifting heavy weights, chronic coughing, chronic constipation, occupation which involves lifting heavy weights. All these conditions, including the urinary condition where there is enlargement of prostate, and because of that a person would have difficulty in passing the urine and the person would strain, and this will also result in hernia. Types of hernias. Hernias can be of many types. We are going to focus on main types, which are the inguinal hernia, the ventral or umbilical hernia, hiatal hernia, and also femoral hernias. Now, how do we diagnose the hernias? Hernias are mainly diagnosed by clinical examination only. Usually, your doctor will examine you and he might ask you to cough a bit or to strain a bit to see whether this swelling gets bigger or not. And usually this examination is sufficient. However, in certain cases, your surgeon might ask for ultrasound, or in other cases, a CT scan to diagnose the hernia. Now, once the diagnosis of hernia is confirmed, the only treatment option is a surgical one. Fortunately, we have got very high-tech surgeries these days, including minimal access keyhole surgeries or robotic surgeries, where we make a very small tiny hole in your tummy. Usually 3 to 4 holes are made, and then by doing the procedure, a mesh, which I have a mesh with me, as you can see, this is a synthetic mesh or a polypropylene mesh, which in other kind of hernias can be a different kind of mesh also, a special kind of mesh, which is applied over the defect of the hernia, and it is fixed by a device called a stacker. So I can show you, this is the stacker by which you fix the mesh, and the surgery is finished in 30 to 40 minutes. Usually there are no stitches, and a person is up and about within 4 to 5 hours. I have an experience of more than 24,000 minimal access and robotic surgeries, and I can surely say that robotic surgery is one of the best and latest surgical procedure for the management of complex hernias. The advantages are significant. Robotic surgeries are very precise. There is less risk of bleeding. There is less injury to the surrounding organs. Also, it makes the surgeon very comfortable and very confident by enhancing the image quality, and also there is a very quick recovery and minimal or negligible post-operative pain in patients treated with robotic surgery. So robotic surgery is one of the latest additions which is highly recommended. If you want to know more about robotic hernia surgeries and how do we do it and the cost, then definitely feel free to contact our team at Cure India. Thank you.
لو تريد العلاج في الهند لا تنسوا الإعجاب في الفيديو والاشتراك بالقناة ليصلكم كل جديد من كيور إنديا.